Today's talk is about what you need to know about breast cancer. It is my pleasure to introduce Dr. Kara Friend with Riverside Surgical Specialist. Dr. Friend earned her medical degree from EVMS, where she also completed a general surgical residency and surgical critical care fellowship. She completed a breast oncology fellowship at the University of Michigan. Dr. Friend is board certified in general surgery and surgical critical care. Dr. Friend is a fellow of the American College of Surgeons. Dr. Friend is originally from Northern Virginia, is alumni of William and Mary, and now considers Hampton Roads her home. Dr. Friend is an avid supporter of the arts and theater. She loves going to new restaurants and really enjoys her 3 rescue dogs. She also enjoys fostering dogs as well. Thank you, Dr. Friend. We really are glad you're here.
Thank you. So, we're going to have a kind of brief talk today, and what we're going to go over is what is breast cancer, how do we find breast cancer, and what can you do to reduce your risks. This is more of a talk about screening and prevention. The talk for what to do if you're actually diagnosed with cancer is a little bit longer, and so we're going to save that for another day. So let's start with what is breast cancer. It's one of the most common cancers in the country at this time. So over 250,000 cases of breast cancer were diagnosed in 2019, which represents about 30% of all the cancers diagnosed in women. The only thing that's more common than that is skin cancer. Unfortunately, breast cancer does still represent a large number of cancer deaths. It is the second leading cause of breast cancer death in the United States. There were over 60,000 new cases of non-invasive cancer, something called ductal carcinoma in situ as well. We are estimating that there will be over 40,000 deaths in 2019 from breast cancer, and that is more than ovarian, uterine, fallopian, cervical, and vulvar cancers combined. So what does this mean to the average person? Well, if you were to walk down the street and count the number of people who've had breast cancer around you, there'd be over 3 million women in the United States that either have a history of breast cancer, and that includes active treatment or past treatment. So what actually causes the breast cancer? I wish I could tell you. Right now, we know that there are certain things that happen with the cell that make it more prone to turn into a cancer, but we don't have a simple, straightforward answer to what causes cancer. What generally happens is within the cells, there are genetic changes that make the cell not responsive to the normal immune system. So instead of your immune system attacking this cell because it's abnormal looking, the immune system doesn't recognize it as bad. And so it lets it keep growing and growing and growing. And that's why cancers start out small, but can progressively grow faster and faster. Now, what makes these changes happen is hard to say. They can be DNA changes, and some of those can be related to lifestyle. Think about things like how smoking gives you lung cancer. But they can also be due to other things such as age-related factors or certain medications, that sort of thing. So a lot of people say, well, I don't have a family history of breast cancer, so I can't get breast cancer. Unfortunately, that's not true either. About 85% of women who are diagnosed with breast cancer have no family history of breast cancer. Only about 5 to 10% of breast cancers are actually caused by an inherited change in DNA. And so when you think about these, think about things like the BRCA gene, the BRCA1 and 2 gene. They've gotten a lot of publicity recently between Angelina Jolie, Christina Applegate, and Beyonce's father. All of them have mutations in this BRCA gene that make them more likely to develop cancer in the future. And it can be a couple different kinds of cancers. Now, while the BRCA genes are the 2 most common, there are a bunch of other genes that can cause cancer as well. And each gene carries its own risk. So if you do have one of those genes, the best thing to do is talk to your doctor about what the best way to reduce your personal risk is. So why did I mention Beyonce's dad? Well, guys can get breast cancer too. So Beyonce's dad carries the BRCA2 gene, and that makes him more prone to develop breast cancer. About 2,600 men will develop breast cancer in 2019. So the man's average risk of a breast cancer is about 1 in 883. And again, coming back to the gene, men with the gene have about a 6.8% chance of developing breast cancer. Now, if you looked at the female side of this, a woman's risk of breast cancer is about 1 in 8 if she lives to the age of 70. However, if she carries the BRCA gene, the same one we were talking about before, the BRCA2 gene, she has a 45% risk of developing breast cancer by age 70. And the BRCA1 gene is a little bit more dangerous, and that has about a 60% chance of developing breast cancer by age 70. So how do we figure out if you have cancer? Well, the best thing to do is to do what's called a screening test. And the idea behind a screening test is that it looks for a cancer before it's big enough to see or feel. The earlier we find a cancer, the easier it is to treat it. Hopefully, if we find it soon enough, that means no chemotherapy and nothing terribly aggressive. Okay. There are a couple different ways to screen for breast cancer. You can screen with a mammogram, with a clinical breast examination, and with an MRI. Again, the earlier we find things, the easier it is for them to be treated. So, breast cancers that are large enough to feel tend to be a more advanced stage and they are more likely to spread. Breast cancers that are found during screening are often much smaller and confined to the breast. And so, in that situation, like I said before, less likely need for very aggressive treatment. The size of your cancer and how far it is spread are important factors in predicting the outcome. When we talk about breast cancer, people like to talk about the stage. And when you talk about a stage, there are a couple things that go into that. There's the T, the N, and the M. Everything is done in Latin in medicine. So the T is Latin for size. And so the bigger the tumor, the higher the stage, the more dangerous the tumor. The N is the nodes. So that's did the cancer spread beyond the breast into the lymph nodes? And those are little glands located underneath your arm. And finally, the last thing, the M, and that's kind of a yes-no thing. The M means metastasis. And that means, did it spread beyond the armpit? Is it in the liver? Is it in the lungs? Is it somewhere else in the body? And that's the most aggressive form of breast cancer. And that's what's called metastatic breast cancer or stage 4. So let's talk about the ways to screen for breast cancer. Okay. First thing you need to do is have breast self-awareness. Ask your doctor to show you any lumps or bumps that he or she feels so that you know what is normal for you. A lot of ladies have fibrocystic breast. And what that means is there is some natural lumpiness to the breast. There are cysts that can come and go when they want to. And they can feel like a hard, solid mass, even though they're just made of liquid. So if you do have some of these, ask your doctor to show you so that if something changes in it, you'll know what normal is for you. Okay. On a clinical breast examination, and that is having a physician do a breast examination, there are some cancers that you can feel, but you can't see on mammogram. These tend to be some of the more rare types of cancer, something like a lobular cancer, and you will feel something distinct on exam, but you won't actually see anything on mammogram. Okay. The mammogram catches cancers that are too small to feel. When you talk about what you can feel, most people say that you can feel something that's around a centimeter in size, so it needs to be at least this big. The untrained person is probably closer to about 1.5 centimeters, so more like this. Whereas the mammogram can actually find something as small as a couple millimeters, so more like that. So the smaller it is, again, the easier it is to treat. So what are the recommendations in terms of detection? So any woman over the age of 40 should have a screening mammogram every year and continue to do so as long as they're in good health. That's where things get a little bit tricky because some people say, well, when should I stop? As long as you are willing to have treatment for a breast cancer, if we find it, you should continue to have your mammograms. Discuss the risks and benefits with your regular doctor. If you are someone that has very dense breasts or someone who can't have a mammogram for whatever reason, talk to your doctor about what your other options are. Mammograms for older women should be based on the individual, her health, and other serious issues. Again, that comes back to what I was saying is if you are not willing to have treatment for the breast cancer, then you may not need the mammogram, okay? Anyone with a strong family history should have a mammogram at 5 to 10 years younger than their earliest family member that was diagnosed. So if your mom and your sister were diagnosed with breast cancer at 40, you need to start thinking about having a mammogram at least 35, maybe earlier than that. And that'll be something you can talk to your doctor about your specific risk benefits for starting that early. Women in their 20s and 30s should have a clinical breast examination, and that should be performed by a medical doctor. It does not have to be a breast surgeon, but it should be someone that performs regular breast examinations. Most of the time, this can be performed by either your primary care doctor or by your gynecologist, whoever is doing your clinical exam. It should be preferably at least every 3 years, but ideally more frequent than that. And again, after the age of 40, women should have a clinical breast examination every year. And that goes back to the idea that there are some cancers that you just can't see on a mammogram. Breast self-examination is an option for women starting in their 20s. Women should be aware of their specific breast tissue. That comes back to what we were talking about earlier with the fibrocystic breast changes and other masses within the breast that may be normal. A lot of times people say don't do self-breast examinations because it gets confusing, and that's where knowing what is normal for you is very helpful. And that's where you talk to your doctor about showing you where are the masses, where are the areas of concern in your breast so that you know what you're looking for. Women who are at a high risk for breast cancer should get a MRI and a mammogram every year. What does high risk mean? High risk means that you have more than a 20% chance of getting breast cancer during your lifetime. So a little bit more than double the average person. And how do we determine it? There's a couple different ways of determining that. The most common are something called a Gale risk model or a Tyrer-Cuzick model. Or if you know that you have one of those genetic mutations. Talk to your doctor to determine if you are at high risk. So I said I was also going to tell you how you can decrease your risk of getting breast cancer. So what can you do? Okay. The main things you can do are basically be healthy, maintain a healthy weight throughout your life. The more fat you have, your body likes to turn some of that fat into estrogen, and estrogen can be food for breast cancer. Be physically active, limit your sedentary behavior. Those are kind of the same thing, but some people can't be as physically active as others. So even things like just a slow walk is better than nothing. Limit your alcohol intake. Anything that damages the liver can also make you more prone to get breast cancer. I'm not saying don't have any drinks at all. I'm just saying be careful how much you drink. No more than 1 drink per day for women and 2 drinks per day for men. For men. But again, a glass of wine here and there is not the end of the world. You absolutely can have that, provided you do it safely. The most important thing to do is get screened. If you are 40 years or older, get your yearly mammogram. And talk to your doctor about your breast cancer risks. Make sure you know your family history, and that includes mom and dad's side. These genes can get passed on from mom or dad. A lot of people will know their mom's side of the family very well, but not know their dad's because they don't think it impacts their breast cancer risk. And if you have any doubt at all about what you're seeing or feeling, go get checked out by your doctor. And that's the quick version of why you should go get screened.
Great. Well, thank you, Dr. Friend. I know you did a great job touching on kind of nutrition and activity. Can you touch a little bit too on specifically, there's been some things out about soy and breast cancer. Is there a link to that, or can you touch on that?
So soy is one of those things that can be turned into estrogen when it's in very high quantities. The average person doesn't get enough soy that is concerning. However, where we start to worry is people who, things like people who are vegans, and that's because so much of their diet is made up of soy. They have soy milk, soy cheese, soy burgers, all that sort of stuff. And so from that standpoint, their soy intake is significantly higher. However, it's kind of like the diet soda thing. When you look at the diet soda, how much soda it took for the mice to have cancer, it was a significant quantity that the average person wouldn't ever consume. Same with the soy. Again, if you keep realistic limits on your soy, the soy doesn't really become a big problem.
Great to know. Carrie, do you have any questions for us today?
I'm looking right now to see if I have anything. I don't see any questions at this point.
Great. Well, Dr. Friend, thank you so much.
Absolutely.
That was the main question that we had come in live today. So, of course, as you're watching this, if you have other questions that come in, please leave them in our comments box today, and we'll be sure to get those answers from Dr. Friend. So we appreciate your time. Thank you so much, and have a great day.
It was an excellent presentation.
Thank you.
Thank you so much.